What is yellow fungus? Causes, symptoms, prevention. Here's how you can stay safe right now. There's been a rampant rise in the number of fungal infections reported amongst people, especially those who have recovered from coronavirus infection. Now, after black fungus and white fungus infection, cases of yellow fungus infection have been reported in India, which doctors warn is much scarier. According to reports, one of the first cases of the yellow fungus infection has been identified in Ghaziabad, UP. While the disease hasn't been notified by health experts or government authorities as yet, the behavior of the disease has been flagged off as concerning. While we continue to learn more information about the same, doctors have suggested that a yellow fungus infection could be much more dangerous than black and white fungus cases, and requires attention from the very beginning since it is an infection that can cause heavy internal damage. Here's an explainer on the same, and some of the ways you can safeguard your health. What exactly is yellow fungus infection? While black fungus infection has been declared as an epidemic in some states, yellow fungus infection isn't exactly new. A yellow fungus infection, much like other fungal infections, spreads via contaminated environments, or when a suspected patient inhales molds, myxomycetes, that grow in the environment. What makes this infection different from white and black fungus infection is the manner of its spread. While black fungus starts off with distinct facial disfiguration, the yellow fungus infection starts to cause symptoms by launching an attack on the body's internal organ and disturbing vital bodily processes. Since the damage caused by the infection is said to be much more dangerous and severe, experts now warn people to start recognizing the infection from day 01 and seek help. How does it spread? Is it contagious? Fungal infections spread when a person inhales molds, and are found in the environment. Now, yellow fungus infections could also be spread via high levels of humidity or the presence of old, contaminated food. However, poor hygiene and unsanitary conditions remain to be the prime reasons for infection. While fungal infections can primarily attack people with compromised immunity, yellow fungus or other fungal infections being talked about right now aren't exactly contagious, since they cannot be spread from person to person like other respiratory infections, including that of COVID-19. The risk of external spread hasn't been found or studied in detail as of yet. What makes a person susceptible to the risks? Depending on your health and risk factors, yellow fungus infections can strike as a primary or secondary infection. However, from what has been evidently seen so far, the risks continue to be aggravated for those people who have compromised immunity, frail health, or suffering from pre-existing problems like uncontrolled diabetes, high cholesterol, which cause inflammation and reduce the body's ability to fight off infections. As seen with COVID-recovered cases, or those in the middle of recovery, a rise in fungal infections has been reported amongst those put on prolonged oxygen support, or who have been prescribed steroid use. The use of steroids has now come under scrutiny from leading medical authorities. It can also develop on the skin after the fungus enters the skin through a cut, scrape, burn, or another type of skin trauma. Additionally, the Centers of Disease Control and Prevention (CDC) state that the risk of fungal infections are also high for people who have spent a long time under intensive care units (ICU), have had an organ transplant recently, suffering from immune complications or low WBC counts, are dependent on extensive antibacterial or steroid use, have kidney damage or put on dialysis. Symptoms of the infection. As per available case studies, the following are the broad symptoms of yellow fungus infection: disrupted digestion, slow metabolism, unexplained unusual weight loss, pus leakage, loss of appetite, malnutrition, scrawny, sunken eyes, lack of energy, lethargy, and fatigue, necrosis, in severe cases, delayed healing of wounds, prolonging recovery timelines. Why is it more dangerous than other fungal infections? From what has been seen right now, one of the reasons why a yellow fungus infection acts out differently from white fungus or black fungus is the way it spreads. Since it spreads internally, it can cause heavy internal damage and hence, more severe in nature. For the same reason, people have been advised to seek treatment from the very beginning and prevent the case from becoming complicated. How can people protect themselves? What we must remember is that we are only beginning to learn information about the new infection. However, like with any infection, one of the best steps to take is to safeguard your health. Compromised immunity helps fungal infections thrive. People suffering from uncontrolled diabetes, or with a history of diabetes, should be doubly careful of keeping their blood sugar levels under control. As for patients battling COVID-19, since one reason for the spread of these hazardous molds is unsanitary environments, one must ensure that proper disinfection is followed. Those on oxygen therapy should also ensure that oxygen is well filtered and not contaminated, such as with unclean water. Indiscriminate usage of steroids and related medications should be curtailed. Additionally, doctors and specialists recommend that any at-risk patient not expose themselves to the risk unnecessarily, follow proper mask mandates, and maintain personal hygiene. Wearing clothes that do not expose the skin to probably contaminated surfaces may also go one step further to protect you. Stay home, stay safe. At these crucial times, people should feel happy from the inside. Like and share the video if you got some value from it. Share as much as possible. Thanks for watching.